bird flu, avian flu, H5N1. What does it all mean for Michigan pet owners and animal caregivers? I'm Michelle Spranger with Michigan Pet Alliance. Today, we're going to answer your questions. We're in Ann Arbor to talk to Dr. White from Michigan's largest animal shelter, Humane Society of Huron Valley.
H5N1 is avian influenza. It's a strain of a virus. It's also known as the bird flu. It's a virus that we have seen in multiple different species, and it's transmitted in a variety of different ways, including saliva, feces, urine. It can also be transmitted through raw meat products and dairy products. This particular strain has actually been around the world since 1996. It originated in China. It's only been in the United States since 2022. It's in the news more now because as of last year, March of 2024, it was first detected in dairy cattle in the United States. Any mammal is potentially susceptible to the bird flu, just by the nature of how influenza viruses continue to mutate and change. It's transmitted through a variety of different means, primarily through saliva, nasal discharge, urine, feces, and milk from the dairy cattle. It can also be transmitted through raw meat products. Our poultry farms have been so drastically affected. As of just a few days ago, the numbers have risen to over 160 million poultry that have been affected by the virus. Currently here in Michigan, the populations most at risk are our domestic poultry farms, our backyard flocks. In Michigan specifically, we've had cases in the red fox, possums, raccoons, coyotes, dairy cattle, and we have had 2 human cases in Michigan. Avian influenza has been detected in domestic household cats. They're finding that being transmitted through them having been fed raw meat products. They're also getting it from unpasteurized milk, typically on the dairy farms. To minimize risk of exposure, it's recommended to not feed unpasteurized milk or raw meat products. At this point, the risk for humans and the risk for widespread exposure to community cats and our domestic cats is low. Michigan cat owners should be vigilant and observant of their cat's clinical signs, of their exposure risk, but at this point, no drastic measures need to be taken. For community caregivers, I would say the risk is higher than our house cats because they are outdoors, they're exposed to wildlife, they're exposed to wild birds, especially come spring and the migratory season. However, at this point, the concern for widespread infection amongst community cats is low, but being, again, vigilant, monitoring their population, and taking action if they start to see any concerns.